Hey, everybody, what a pleasure to be here. This, I hope, will be an inspiring webinar. Webinars are always a bit trickier than, I guess, one-on-one or in person or hands-on. I wouldn't say trickier. I want to be able to communicate the passion I have for this subject matter with you guys, through the web. I'm actually in Osaka, Japan right now, so we're relying on a good internet connection. I'm in the future, I guess. I'm like 10 hours ahead of most of you guys. So one of the things I want to go over with you is just um, let you know that I think that this will be an inspiring hour that you'll spend here. For most dentists, especially post-pandemic, a big problem has been burnout and just getting tired and bored sometimes with some of the things that we do. Our staff are asking for more money, our reimbursements down, and this is going to be an opportunity for you guys to learn something that can be an antidote for a lot of those problems. It can bring money into your practice. Somebody here tonight in the 100 or 50 or 300 people, I don't know how many are attending, somebody here tonight will latch onto this concept and will do something special with it. Somebody will become really, really good at this skill. Somebody will retire early because they understood the principles in this presentation. And some of you are just going to find something else to do that's going to be more fun and more enjoyable. And I want to hit on those points a little bit later, but let's jump in. I want to tell you guys a little bit about how this came about. So here is what happened to me in my career. I want to kind of explain how all this came about and let you learn a little bit about my story. About 2016, things were changing in dentistry. I was in Portland, Oregon. I was doing a bunch of porcelain veneers, and what I was finding was that I wasn't enjoying it very much. I was having this trouble with preparing veneers and then not getting back from the laboratory what I'd hoped, or maybe, I wasn't getting the exact shapes that the patient wanted. And I would always be able to fix it. I could always correct it, but I wasn't enjoying also the process of having these young people come in and see me for veneers, and maybe they're 26 or 27, and I'm cutting down healthy tooth structure. And it always made me a little bit nervous about that. And so I always felt this sort of pit in my stomach whenever I was doing traditional preparation. And in about around 2016, some things were happening in social media. It was sort of the first time when we started seeing people show pictures of teeth on Instagram, for example. It wasn't clear what Instagram was going to be. At the moment, we were just doing pictures of food and landscapes and things like that. And it wasn't obvious how we were going to use Instagram as dentists. But the first people to do this well were in Dubai and Brazil. And I started getting pictures from Brazil in particular of these beautiful, beautiful veneers. And I would read the caption. And I was lucky enough to learn Portuguese when I was a kid. And I would read the caption and I would see, oh my gosh, they did this without any preparation. They say same desgaste, meaning just like no preparation, no wasting away of the enamel. And I couldn't believe the beauty of the product that I was seeing. And so I started to research more and I started to connect with dentists in Brazil and UAE and other places. And I discovered about a dozen people or so worldwide that were doing incredible things with cosmetic dentistry without shaving down any of the natural tooth structure. And I just knew at that moment that that was what we needed to do, especially because, guys, we are in an image based decision making process with consumers. Consumers are making most of their decisions based on images that they see on TikTok and Instagram. And I could see this already happening. The idea of the old school credentialing, meaning going to a great dental school and having this plaque out in front of your office that said Harvard, that was going away. And consumers were looking more to images on the internet and social proof to make their decisions about where to go. The other decision that they were making because of images is they were looking at traditional tooth preparation and they were seeing that that wasn't for them. They did not want that. So images were starting to really just permeate our society and people were making these decisions based on these images. So I made a very drastic decision. What you're looking at in this slide is me in Cuba. Those are my kids down there next to me. We're outside of a cafe. And I made a big decision, but I came home and I asked my wife, I said, listen, this is the future of cosmetic dentistry. Non-invasive composite resin has got a long ways to go in cosmetic dentistry. We're going to be using it for years and years and years. Look at what people are able to do with this. And we made a decision to do something drastic. We decided to sell the practice, sell the house. We went to Target or something, bought the kids a bunch of outfits, maybe 3 outfits each, and a little tiny suitcase. And we went on the road for 2 years. And I just said, we're going to go to a new country every 2 weeks. I'm going to sit down with the best person in Italy at composite resin, the best person in Sweden, the best person in UK, the best person in Australia, in Brazil, Colombia, all over the world. And we spent 2 years on the road going to dentists all around the world and picking up skills in this area of composite resin. So I would arrange with these dentists to spend a week with them, a couple of days with them, whatever it was, and I would try to understand how they were using composite resin to do non-invasive procedures, especially cosmetic procedures. And it wasn't always easy, you guys. Sometimes we ended up like this. So every now and again, we were homeless. I mean, we were in Airbnbs most of the time, but this was one night when we went to an Airbnb and there were some bed bugs in the Airbnb. And we tried to go somewhere else. We ended up sleeping in a subway in Paris. I mean, this was quite an adventure. And my kids were real troopers. They went with it. It worked out. And eventually we ended up in New Zealand in a practice down there. And I really, really went to work as an engineer, as a material scientist, and less so as a dentist. I started engineering my way around a lot of the problems with composite resin that I was seeing some of the other dentists have. So while I picked up great tips from all these dentists, I wasn't learning everything that I wanted to learn. And some of the things I didn't think would work for me. But that's a little bit about the story about how all this came about. Eventually, I came up with a good product and a method and a technique that I'm calling the Halo technique. And I'm going to teach you guys about that tonight and show you how I do this. Just as an overview, my goal was never to be the greatest artist in the world. I always wanted to make this an engineering feat. I always wanted to make composite resin less artistic because one of the big problems that I think you're going to find as you go around and take classes in composite resin, especially in aesthetics, is that when you go to these classes, what you find out pretty soon that the person that's teaching that class, they're amazing. They're terrific artists, and they're doing things with composite that frankly us mortals can't do. And to me, the biggest problem with composite resin is not that it chips or stains or anything like that. In fact, it doesn't. I'll tell you more about that later. The biggest problem with composite resin is that it's difficult to do. It's really hard. And so my goal has always been, how can I engineer a series of guides that will help dentists do this without being Picasso? We don't want you to have to be the greatest artist in the world. We want you to be able to do this with a series of guides that gives you a structure to be able to replicate a wax up and get this right without being artistically, super talented. So of course you need hands and you need eyes and you need to be a little bit artistically talented, but you don't have to be, perfect. We just want this to be able to easy for you. So let's go to this next slide here. So we need to rethink a lot about cosmetics in the Instagram age. And I'm going to tell you why here in a minute, why I'm seeing these trends move this direction. So when you're a patient and you're searching for cosmetic dentistry, what is it exactly that you're finding? I want you guys to think about this. There are companies like Yelp, Quora, Reddit, and others that are always going to be at the top of the search bar. You are never, no matter how good your SEO as a dentist is, you are never going to be at the top of the search bar relative to those companies. So when patients are searching for cosmetic dentistry, they're finding Reddit way before they're finding you. Okay, you're way down there, but somewhere at the top of that search bar is going to be these other forums. Now, what are they finding on these forums? That's what's interesting. So they're Googling stuff, they're finding stuff on their laptop or their phone. They're maybe using maps to find cosmetic dentists, or they're learning about cosmetic dentists. But what they're actually finding is pictures of traditional tooth preparation. When you look at TikTok, man, there are some videos going around of just horrible, brutal preparations. And people associate those terrible horror stories with veneers. So when you ask an average person, hey, what about veneers? They're like, oh my gosh, I don't want to shave down my teeth. I saw this thing on TikTok. And those videos are more powerful than you and I can ever be. We can't go that viral. But what we can do is take a different approach to this. So they're seeing these traditional tooth preparations. They're searching. They're finding these traditional tooth preparations on the internet. And guess what? They are not scheduling veneers. So if you go down the street right now and just ask a stranger, do you want straight white teeth? The answer is almost always yes. But immediately, that person is going to come up with a bunch of reasons why they don't do that. They're going to say, well, it costs too much. and I saw this horrible video on TikTok, and don't those pop off? And oh yeah, my friend had those, and they look horrible. They look like dentures. There's all these but. But if you could just ask them, hey, I'm a fairy godmother, and I can just like wave my magic wand and go bibbity bobbity boo, and you've got perfect, beautiful, straight white teeth. Would you do it? The answer is yes. Yeah, 90% of people are just going to say, absolutely, I do want great, healthy, beautiful white teeth. But they're always thinking in the back of the mind, but this, but that. And the biggest but that in the industry right now is preparation. It's cost maybe and preparation, but they're afraid of the cost and they're afraid of drilling down their teeth. Now, if you can get past that drilling down the teeth part and you can address the cost a little bit, you've got an amazing product. And that is why composite resin veneers are actually the future. They are first choice option, not a second choice option like some people think. Okay. So these are some things that I found on the internet. Look at this. Preparing my tooth, I learned, meant grinding them down to little stubs. This is a quote from somebody on Reddit. He said he would need to roughen my tooth enamel to enable the veneers to stick. I wasn't surprised, therefore, when he took my mouth and started when he numbed my mouth and started polishing away. When I looked in the mirror, I saw my previously healthy teeth had been drilled down to tiny misshapen stumps. Okay, that's on Reddit. That's going to be at the top of the search before you. And here we go. Here's some photos to go along with it. Okay. I went to run my tongue over my teeth and it recoiled like a slug that had been salted. What was left were short pencil-like pikes. I looked in the mirror and shuddered. Nosferatu grinned back at me. And I didn't know who Nosferatu was, so I had to look it up, but this is Nosferatu. And yeah, I mean, this person's absolutely poetic in their description of what happened to them. So then the question is, well, hey, Dr. Ballard, what about minimal preparation? Well, good question. What is minimal preparation? Can you do it on every patient? When is it, when is it appropriate? So prep design is getting more sophisticated, and I think that's a good thing. So because of these images that we're seeing on the internet, dentists are getting smarter, and they're saying, well, we don't do that. We do minimal prep, or we do micro prep, or we do something. But minimal prep and micro prep, they still mean prep. That enamel is still gone. If you use fewer guides, you're going to have less preparation, or excuse me, more guides, you're going to have less preparation. But minimal prep and micro prep is still require removal of enamel that's never coming back. So it's not appropriate for kids. It's not appropriate for many young people, in my opinion. And we still have to be honest with our patients. We can't just say, hey, it's minimal prep, don't worry about it. Well, yeah, we're taking away enamel. Are there going to be some of the same problems as like a crown preparation? No, but we need to be conservative with that too. I think, and I don't mean to be like cynical here, but it does seem to me like a little bit like dentists are inventing terms like micro prep, minimal prep, almost no prep. They're using these terms to try to calm the patient's nerves about preparation, but we're still prepping. Okay. So there's a big difference obviously between a crown prep and a veneer prep, and I get that. But most, especially kind of beginner cosmetic dentists, are gonna make those preparations look more like a crown preparation. Now, this is a very interesting and maybe even touchy slide. In my opinion, we measure things completely wrong in dentistry. So a lot of research is like, well, how long is that zirconia crown going to last? Doesn't a zirconia crown last longer than a composite veneer? Yes, 100%. The zirconia crown lasts longer than the composite veneer. In fact, here's some fun news. When aliens find our dead bodies in 8,000 years, they're going to find a bunch of zirconia crowns on our teeth because those things are never going away. So the restoration lasts a really long time. But does the tooth last a long time? That's what we should be measuring. We should be measuring how long does the enamel last or the tooth last. But instead, a lot of our research is based on, well, how long does the restoration last in life? So you can say, hey, crowns last longer than composite veneers. It's like, yes, the crown lasts longer. But this is what we found this study just recently, and I've got this. This is Prime Dent 2003. Volume 2, 78 through 74. This is the reference here at the bottom. But crowns provide the summary. What we found in the study, crowns provide better survival to reintervention. That means that when you put a crown on an anterior tooth, it lasts longer before you have to do something else with the crown, before you have to replace that crown. However, crowning an incisor or a canine tooth, meaning any of those anterior teeth, as opposed to placement of a direct restoration, will lead to an earlier time to extraction of the tooth. Okay. So again, the restoration lasted a long time, but the tooth didn't. You start crowning, I can show you some other studies on this, but if for every 100 veneers that are prepped, you might have two or three lateral incisors that get sensitive and require root canal therapy. And as you guys know, those break at the gum line all the time. So we need to be more careful about how we measure success when we're talking about anterior aesthetics. Bottom line is, guys, doctors that can deliver highly aesthetic result without having to shave down natural teeth, they're going to be in high demand, and you're going to find your work more rewarding as well. So I know this to be true. I've experienced this myself, and a lot of people, some of my students have as well. So, what are your concerns with composite veneers? These are some of the main concerns. People worry about them chipping. People worry about them staining. They can have inflamed gums around the margins. Sometimes the margins are bad, and sometimes there's poor aesthetics. What I've done is I've attempted to address all of these issues in the way that I've engineered these veneers. You're going to see how I've done this in several ways, but I think that most of these are myths about composite veneers. A myth could be that it chips or breaks, that it stains, that it causes gingivitis, or that it's not as aesthetic. They can be just as aesthetic, if not more aesthetic than porcelain, for sure. I can show you how we've addressed the gingivitis. They are very color stable. Most of that stain that we refer to has to do with the old composites that had a lot of amines in them that would discolor over time. And I can also show you how I have got a fracture rate that's almost zero. So I have placed about 5,000 of these veneers in the last 6 or so years. And I can tell you, I've actually never had one completely pop off. And I cannot say that about my porcelain veneers. I have my porcelain veneers pop off from time to time. I've had some chips, and I've got about 3% so far that have chipped, but I'm not having them break. And I'll tell you why in a minute. Let's go to this. So here's some features of halo veneers. So they're thick. The incisal edge is really thick. I mean, it's like 1.5 to 2 millimeters thick. And what we find out, guys, is that when we're looking at for example, concrete. If you had concrete that was just a few millimeters thick, you could break it with your fingers. But when you double that and you make it a centimeter thick, the strength is not linear. It doesn't get twice as strong when you make it twice as thick. It gets like 8 times as strong when you make it twice as thick. The same is true of composite resin. When you have composite resin that is 2 millimeters thick, it's about as strong as tooth structure. And so while people do chip their natural teeth as well, this stuff is pretty hardy, and I rarely have it chip or break. We have an air inhibited layer at the gum line for almost zero inflammation at the gums. The seams and margins are beautiful, and they are sort of tucked around the tooth. You can think of it a little bit like a vehicle wrap going around the other side of the door, like a vinyl vehicle wrap. If we have a decal on the door, that's going to have a margin. If we have a wrap that goes on the other side of the door, that kind of hides the margin. That's the way these composite veneers work, the halo technique. It goes all the way around the tooth. We have superior aesthetics to porcelain in many ways, especially because we have so much control. And we have nano-hybrid composites at the points of function where we need the strength, and we have microfilled composites on polished surfaces where we need the beauty. They're very color stable, especially with SDI products and other more advanced engineered composite resins. They're going to be very, very color stable and stain resistant over a long period of time. So this is where I get excited. I love being able to do stuff that doesn't scare me or doesn't have a huge cost. I don't like doing, for example, third molar extractions because I don't enjoy the experience of feeling like something could go wrong, especially if I'm close to nerves and things like that. So I love using the halo technique, composite resin veneers, because they are repairable. If you did get a chip, it's not a huge deal. It takes about 30 minutes to fix. It's easy to do. Patients are happy and they're out of there. And the repairs hold up really well. They are reversible. This has never happened, but if a patient absolutely hated them, I could just take them off. That's not true when we do porcelain. They're non-invasive. You're not going to hurt anybody. You're not going to have a patient come back with sensitivity. There's no lab bill, so they're very profitable. There's low legal risk. There's low complication risk. And it opens up so many more people to be able to do this type of procedure, including teenagers, which you wouldn't be able to do with porcelain. But potentially not as strong as porcelain. So you could have some chipping and staining, but it's rare. So the big question is, then why are we still prepping? If we have this thing at our fingertips, we have this technique, why would we prep teeth when we can do all these things, with composite veneers? And I think there are some good reasons for that. There are some good times when preparation is required. But overall, I believe, and a lot of people like me believe, that composite resin is a first choice, not a second choice to porcelain. Um, my good friend Clécio Alves in Brazil, he always says, "Quem critica resina não sabe fazer resina." What he's saying is the people that criticize resins because they don't know how to do resin. So if we learn how to do resin, we can do it in a way that's very, very good. Let's talk a little bit about just theory, and I don't want to bore you here, so I'm going to go through these pretty quickly, but I want to talk to you a little bit about how composite works. Um, Basically, the bigger the filler size, the stronger the composite is. But those big filler particles also make things less polishable. So if you have a great big filler size, for example, this nano hybrid, those are strong. That's like the Luna 2. They're a hearty composite. They don't always polish as well as a microspherical or a micro hybrid. But those big particles, think of it like cinder blocks and maybe like the McDonald's balls. Remember the little ball pits where they used to have like you could jump in and like swim in these balls, tennis balls or something that rolls around really easily. Those spherical particles polish well, but they chip more and don't have a tensile strength, whereas a nano hybrid is going to be stronger. So we want to put the nano hybrids where we want strength, and we want to put the micros where we want beauty. This is just kind of quick overview of Luna 2. So Luna 2 is a nano hybrid, but it also polishes pretty well. So I like to use this as the base of my composite resin veneer, and then I usually layer a micro spherical over the top of it to get some depth and to give it some more polishability. But Luna, what I like about it is, I know we always talk about handling, and it seems like such a cliche thing, like, is anybody really paying attention to handling? The answer is, well, I mean, I guess, let me see that differently. All composites you would think kind of handle the same, or maybe it just depends on how you feel about them. But I think as I've gotten more sophisticated, I've realized that it really does matter, particularly when we're trying to be careful about introducing bubbles and things like that. A sticky composite, you don't want any bubbles on an aesthetic restoration. Actually, you don't want any bubbles anywhere, but particularly not on these because it'll pick up stain. Luna 2 is going to spread a lot like margarine on toast. It just kind of flows almost like I want to say greasy, but it's not honey-like. It's not sticky, and it's just easier to put in there. It's got a very good structural and compressive strength. And so I like that for the areas where I need to kind of compress it into little areas, or where I need strength of like resistance on the incisal edge. Like I was just talking about, easy to handle and not sticky, doesn't slump, kind of holds its shape. Some people have asked me like, hey, are these things toxic? Well, the Luna 2 is BPA free, and I think that's important for some people. We do probably kind of suck in a lot of these microplastics, and I think it's important to know that some of those are BPA free. And it's radio opaque, so you can kind of see where your restoration ends and begins. One of the things that I'll say about the SDI product versus other products is it's got a little bit lower chromatic effect. What I mean by that is it's not quite as saturated in its color, and it's great like when you're trying to match existing two structure. So let's say, for example, we want to do 4 veneers. That's a Luna 2 case. I don't want to try to go with a composite that's going to have a big shade change. I want to do that in a way that the composite's going to pick up a little bit of that underlying substrate color and make it a little bit easier to work with. So that's some of the reasons why I like to use that composite in those. This is just what I was referring to with chroma and opacity. So both of these things can affect the way that our restorations come out. And I find that, frankly, composites that have a very, very high opacity or very high chroma, sometimes they can kind of give me that gleamy kind of PFM look to them. So I like something with a little bit more ability to pull in some of the natural light and show the substrate just a little bit more. It's sometimes you actually do want to block that out. And to do that, SDI makes a dentin shade that is going to block that out a little bit more. But when I'm trying to just like layer enamel, I want to use something that's got a little bit more transparency to it to give it some depth. I like to use tints and opaquers, and the reason I do this is because we want that incisal edge to look real, but we don't always want to lengthen the tooth. So like when you see the Brazilians do this, they always have like this little clear you've probably seen this on Instagram, a little clear layer of composite that's coming down. And then they bring their dentin lobes into that clear incisal tip. It's called the palatine conch is what they call it in Brazil. I like that, but what happens when you already have a tooth that's too long and you still want to veneer it? Or when it's just the perfect length and you still want to veneer it? It doesn't give you options to try to give you that incisal translucency. For that reason, I use tints. And I love the SDI tints, but I'm going to tell on Adrian here. I think they might maybe be discontinuing those. I don't really know. You have to talk to Adrian a little bit more about that. But I like using tints with the composite because tints allow me to put that blue and that gray incisal edge there without actually having to have the real translucency of a longer tooth when we put that composite on there. So a couple of more things on the Luna 2. We always talked about BPA free and the outstanding handling. It's a little bit of a repeat slide. Sorry about that, guys. I put this in kind of last minute on this one. It is easy to use with the Vita shade. That helps. So let's talk about factors affecting the longevity of composite resin, because people think, hey, these things don't last as long. The reality is there's some really easy things that we can do to make sure that they do last as long. Did you guys know that composite resin can be hard to the touch and still only be up to 9% cured? We are not curing most of our composite resin restorations for enough time with these curing whites. And so a big factor in how long these things last and if whether or not even our class 2s and class 1s have sensitivity on them is if we've really, really deeply and thoroughly polymerized them. So these are kind of my 4, I guess, pillars of longevity for my composite resin veneers. You got to get the occlusion right, and that just seems something simple. I just want them to hit bilaterally, same time, same, both sides at the same time, and then I want them to have a little bit of canine guidance. Beyond that, I'm not going to complicate this. I want them to hit on functional cusps on their back teeth or on marginal ridges. I don't want them to hit on non-functional cusps, and I don't want interferences going left and right. And I certainly don't want them to hit directly on the composite margin of my restoration. But good photopolymerization. So I polymerize these guys with a very good light for up to 90 seconds. I'm not doing the 20 seconds that's recommended by the manufacturer. That's not long enough. It's a good long polymerization, a great finish and polish, and then great home care. If we can do those 4 things really, really well, our composite resin veneers are going to last upwards of 10 years, sometimes even longer. And then the other thing that I put on here, just as a side note, is the quality and composition of resin. If we put nano hybrid all over the facial surface where you should have a good polish, that may not work long term. You may not be able to keep that shine there for a long time. So there are some things you have to do to layer these to get the right kind of resin in the right place. I'm going to go over that next here with you guys. Case selection, almost most arch forms can be done, or at least enhanced, but we don't want more than a millimeter of crookedness, let's call it, more than a millimeter of discrepancy between the adjacent teeth. And some cases require ortho, but almost every case can be done with a little bit of Invisalign and a good wax up. We obviously want to avoid class 3s. That's not going to work really, really well with this type of veneer, but class 1 and class 2 occlusion is pretty well ready to go. Okay. In smile design, I want to keep this pretty simple. I don't want to go too deep into this because we probably don't even have time for all the principles of smile design, but I'm using some basic principles. I want the smile line to connect well with the interpupillary line. I want it to be level with their face. So I just get an iPad, guys. A simple iPad. I take a picture. I open up Markup. If you don't know what that is, it's already included on your iPad. You don't need to buy it. And I just draw some lines right through the pupils, right down the straight, through the middle of their face. And then I check their smile line relative to that. And I find out what's going on with that. What's going on? Is their midline correct? How's their buccal corridor? Is their maxilla canted? And from there, I'm just going to figure out what do I need to do to that midline to get that straight up and down? What is the ratio of the height and width of the central incisors? And what do I need to do to build off those central incisors to make the smile look good? So here's a little smile checklist that I'm going to go through here. I'm going to find out first, is the midline coincidental? So I'm going to take my little ruler here on Markup. I'm going to draw a line on her pupils. Then I'm going to check here her midline. I might measure the midline of her face. I'm going to check her midline in her teeth and see where we are on that. I want to make sure that the smile line is parallel to her interpupillary line. And then I want to find out, I'm going to draw another line right kind of center of her pupil here. and I want to see, does her buccal corridor come out close to the center of her pupil, or do I need to expand that buccal corridor? What are the gingival contours like? And from there, I'm going to be able to kind of analyze her face a little bit more. I do detect here, look at that midline. She's got more gum on one side than the other. And so I might zoom in on that and just understand a little bit. Is that midline tipped maybe a little bit? There it is. Look, relative to that line, yeah, her midline is just tipped about 1 degree. I'm going to kind of measure that. And now I know. And this is just an easy facial analysis that I'm doing on an iPad. You don't require any fancy software, but I can tell, yeah, that midline is just a little bit tipped. And now I know it's there. And when I go through the process of waxing up, I'm going to know that that's there. By the way, guys, I'm not actually waxing anything up with real wax. I can show you how to do this. I just take a scan and I send it to one of my digital designers in Brazil, and they take care of it for me. But I might make this note to them, hey, watch that midline that's off about 2 degrees. If you want information on how to get those digital wax ups, they're very inexpensive and they can be printed in a lab locally, or if you have a printer in office, you can print them there. This is kind of my master slide when we're talking about smile design, and I just want to walk through this. But when we are designing a smile, we're looking for some key things. The central incisor should be, as you can see, the 80% there, 80% as wide as it is high, roughly. Now for women, that's going to be about 8 millimeters wide by about 10. Men might be 8.5 by 10.5 or 11. So it can be a little bit larger, but the ratio is 80%. The ratio of height to width on the lateral from when viewed from the center, from straight on, is 65%. Roughly, we're going to have that central 10 to 10 to 10.5 long, the lateral is 9 long, and the canine is 10 long. I wrote these circles in here because I wanted to demonstrate where the curvature in my mind should be. The distal aspect of the central incisor is more curved than the mesial aspect. And I use circles and tangential lines to sort of mark where I think those curvatures belong. As you can see, I've broken the tooth up into thirds, like the central incisor is broken lengthwise into thirds, and I'm using those thirds to estimate where I want those curvatures. So really, I've got a mathematical formula here. You can save this slide, and what I would recommend you do when you're trying to design a smile with your designer, take a picture on your iPad or even on your phone and just reference this slide and try to figure out where things are different. For example, this incisal embrasure on between 8 and 9, in my mind, and to my aesthetic, should be 1 millimeter deep and 60 degrees wide. Now you have a measurement. Is that going to be like that way every single time? No, people are different, but this is where I like to begin. The embrasure between the lateral and the central, in my mind, should be 90 degrees wide and about 2 millimeters deep, meaning 2 millimeters from the incisal edge of the central incisor, and so on and so forth. So I'm not going to go through this entire slide, but this is the slide that I use to design my smiles with my designer so that he can create me the guides that I'm going to need to make these beautiful restorations. Okay. The central incisor has a mirror area and a shadow area. And I've got this labeled over here, but you can sort of look at the slide here. Look more on the right side of the slide. The mirror area is the part of that central incisor that reflects light back at you. The shadow areas are where it starts to curve into the embrasure. And those shadow areas can be wider or more narrow, depending on how wide you want that central incisor look. So if you want a more dainty feminine look, narrow that mirror area a little bit. If you want a big, broad kind of square look, widen that mirror area. The tooth is going to be as wide as it is. It does that. We're not going to be able to control that because you have so much space there for a central incisor. It could be 8 or 9 millimeters wide, or it could be less than that. And we can deal with that more. We can sort of control the width or the appearance of the tooth's width by just correcting that shadow area, making that wider or more narrow. This is another key concept in design here. So I'll go through these quickly, but centrals can be oval shaped, they can be square shaped. The most popular and the one that qualifies for the American Academy of Cosmetic Dentistry is more like a rectangular. That's where we get that 80% wide and high. The zenith, or the highest point of the tooth, is going to be distal to the center. That's where the gum line is the highest. And then we have even some triangular ones. And I'm going to show you an example of some beautiful triangular work. This is my friend Clesio that I referred to earlier. Those are composite. Those are composite resin veneers, beautifully done, more of a triangular shape. Lovely. That was done in one visit with Clesio down there in Brazil, and I forgot the name of the city, Recife. That's where he is. Remember that there's contours to the facial aspect of these. So cervical third is going to have more of a tip in towards the gums. The middle third is going to be sort of flat, and the inside is going to tip in again. So the central incisors, they are not flat this direction. They do have a nice curvature to them. Just kind of remind yourself of that as we're doing some of these in the office. That's kind of the external anatomy of those central incisors. Let's talk about the internal anatomy. So I'm pointing out a few little features here. There's a halo on the incisal edge. That's that sort of more opaque, bright tint that goes around the very edge of that tooth. You can see the mamelons there indented. And then oftentimes you'll see these blue translucent corners and incisal edges. And you can see this again here. There's a high value, low translucency area right here on the cervical aspect of the tooth. Bit of a transition zone in the middle where it's neither bright nor clear. And then towards the tip here, we get more clear. And please notice how blue that coloration looks and how far up the side of the tooth that blue translucency goes. Okay, keep that in mind because we're going to use that when we do our tint stuff. So if I were using SDI tints, in my hand, I would have a blue, I would have a gray, and I would have some opaquer. And I'm going to just roll through this video here for a second. Watch where I would put it. I would put the blue pigment there in the corners, and I would go up about a third of the way up the tooth. Then I would probably do a little more blue, and I might even mix that blue with some gray. And I would use that blue and gray to cover more of the incisal edge. And I'm going to show you in real life how this works here in just a moment on some video. The blue and gray mix to create that incisal edge translucency. A little more gray there. Cool. Now that takes care of our halo and our translucency. That now we want to kind of create those effects with some mamelons. Now that can be done with dentin, but in my mind, it's easier to do it with tints. So if we can get, or opaquer in this case, if we can get some opaquer, that's another tint that we can purchase. It's like a little resin. If you guys haven't used it before, just think of it as a flowable resin that you can sort of paint onto the tooth. Okay. I'm going to zoom forward here just a little bit. But I'm going to use that stuff to create those effects of mamelons. So I'm going to grab it. In this case, a lot of times I'll use like a pink opaquer. Sometimes I'll use a white opaquer. Think of it as a flowable composite. It's kind of more opaque. And I'm going to put some of that flowable composite right over those areas where I want the mamelons to be. And you're seeing me color that in now. And I'm just going to put those mamelons in there. And I'm going to, by just using a little bit of these colored flowable composites, I'm going to be able to create this effect to make that tooth look very, very natural. Okay. So just kind of showing this here from the sagittal view, this will give you an idea also where I'm putting different types of composites. Right here, where you see this red stuff going on here, that's a nano hybrid. Why do I put a strong nano hybrid there? I put that there because that's where the patient's going to be biting on stuff. So this is kind of like layer one. We're going to put a tip on nano hybrid. We're going to put our tints where you see that blue stuff. That's those flowable pigmented composites. And that's going to create that effect. And then we're going to cover up our tints using a micro, maybe more like a clear, maybe a little more transparent micro hybrid or micro fill. And that's going to lock in those tints so that everybody can see them, so we can actually see it. Here I've written down trans opal. That means trans meaning translucent, or opal meaning a little bit milky white, one of those two colors. And then we're going to finish up the body of the veneer using a micro hybrid or a dentin layer if we need it to block out some more light. Okay. Let's kind of follow along on this drawing here just for a minute. Microfill and microhybrid. And I wrote there high chroma. That's just if we're trying to modify the shade, we have a tooth that we want to make brighter. We can use something with a high chromatic value. That would be like the SDI Dentin. And on top of that, we're going to finish up with one of the enamel shades. That could be the Aura. That is a microfill, highly polishable composite there to give us our shine. So it's not that complicated compared to other types of things. That seems like that's a lot of different types of composite, but let me break this down for you in a little bit easier way. You guys will see how this works in just a second. So pre-op, I like to pack a cord. I didn't used to do this, but these days I'm packing cord on all my patients to make sure that I don't get any composite up in places that I shouldn't. Okay, we can go to the next one. I do remove any old composite from their teeth, and I do some light burr abrasion, depending on if I have any stain or plaque on the tooth. And I'm talking very light. We're just abrading the tooth. We're not prepping the tooth. I use the first guide, which is that blue one that you see there. That is just a putty matrix that I've created of the incisal edge of my wax up. And here I've loaded that blue putty with nano hybrid composite. In this case, it would be Luna 2. And as I load that in that putty, I'm just going to put that Luna 2 right up onto the tooth surface there. And there we go. And I've obviously etched and bonded those surfaces and cleaned them. And now I'm adding, remember, nano hybrid, where on the points of function where we need strength. Just as a quick little review, uncured resin, when it's exposed to oxygen, is left with this sort of gummy appearance on the outside edge. That gummy appearance is resin that is not cured because it's touched oxygen, and it's going to be rougher and it's going to pick up more stain than, for example, one with an oxygen inhibited layer that's going to be very, very smooth and clean. So that oxygen inhibited layer, that's going to be the kind of layer that we want next to the gums. Let me show you how I accomplish an oxygen inhibited layer. This slide is a little bit difficult to see, but if you'll follow along, you're going to see that I've got a piece of just plain mylar. Nothing fancy, guys. A clear plastic mylar. And I've tucked it underneath the gum tissue up against my cord. That's all I've done. Just tucked a piece of mylar, mesial and distal, and pushed it up underneath where that cord is. What I'm going to do is I'm going to get a little bit of this Luna 2, and I'm going to push that Luna 2. Remember, it spreads like margarine. I'm going to push that Luna 2 up underneath that hood of mylar. And as I do that, I'm going to cure that in place. And basically what I'm creating here is, think of it as a class 1 restoration. I've already kind of made a wall here at the incisal edge. Now I'm going to make 3 more walls, and I'm going to make sure that there is an air inhibited layer. Just like we talked about, that mylar is going to touch the composite and create an air inhibited layer next to the gums. That's the smoothest it's ever going to be. We don't ever need to polish that again. Watch and you'll kind of see how this works a little bit. So I'm going to place that Luna 2 very carefully, and I'm just going to push it up underneath there. And you can see that mylar is holding my Luna 2 in place. And I'm not creating anything more than just a frame of composite. And I'm going to very carefully tease this composite all the way down on both sides. And I'm creating a frame. You see this up here, this is going to be so smooth, so clean. And when I get that, I think my patient might be snoring in this video. That's good. It's a good sign. Once I get all that completely around the edges of this composite or this restoration, I'm going to cure that in place. And you can see, look right here where my mouse is. I don't know if you can see that or not, but that is going to be so smooth up in there. You're never going to stain that. It's going to be very, very clean. And you never have to polish it with your burr in the next steps. You've already got clear, tidy composite on all sides of the tooth. You're just creating like a class 1 restoration. Sometimes I'll use flowable in those situations. So if I don't feel like I've got a tight spot and I can't pack that Luna 2 up in there, sometimes I will use the Luna Flow in those areas. Now that I've got that frame around the outside, okay, I'm going to begin by, this is where that inhibited layer is, here and around here on the incisal edge. Now I'm going to add more of a body of composite. This is that chromatic composite to change the shade a little bit. And I'm just going to place this stuff. You guys don't need to be bored by watching this, but I'm using an Optrosculpt and I'm just going to spread that composite all around the inside of my frame there and make sure that I've adequately changed the color to what we want it to be. Watch the use of tints, please. So now that I've got a nice frame, you can see the frame of composite here around this slide, and I've got 8 and 9 going here. The tips are in a good place. The frame is in a good spot. I've got some body of composite here. Now look what I'm doing. At the edge of this paintbrush is that gray composite, or that gray flowable, those gray tints. And I'm just going to lightly put some of that gray onto the incisal edge and just paint it in there where we have to have some gray translucency. Next, I'll use blue. So I'll put blue tint, flowable composite, around there in the corners, and it will go up both mesial and distal, up the corner a little way, and around a little bit on the incisal edge as well. The next brush you're going to see is that pink opaquer. And in order to create a halo, I am going to lightly, ever so carefully, paint a little bit of this flowable, white flowable composite around the outside edge. Look at the design of this, though. It's like a trough. It's like a class 1. It's like you've got a class 1 filling here. You've got a frame around the whole outside, and your only job now is to fill in that middle part with the appropriate type of composite. It's actually quite easy. You can get it done here in just a few minutes. If I want to create mamelons, I will do that by placing 3 dots, 3 separate dots here of this pink opaquer. And then I'll just use an instrument. Those 3 dots represent the 3 mamelons, of course. And then I'm going to draw those 3 mamelon dots down a little bit with an instrument. You can see them there in that slide pretty well. And now I'm just going to use this instrument to, it's like a little explorer. And I'm just pulling on those mamelons, kind of pulling them down. Now we have our tints in place. We've got some translucent. Look at this at the top of the zenith here around the gum line. Look how clean that frame is. Absolutely lovely margin. Good margin on the mesial and the distal. We've got our tints and our translucencies and our blues. They're kind of hard to see in this film. We've got blues and grays in place and these little mamelons in place. All that's left to do now is fill in our class 1, and all of those features are going to be there. So again, we're going to use a little bit of a translucent composite here in order to cover those blues and those grays up a little bit. And I'm using either translucent enamel shade. I just wanted a little bit more clear on the bottom, but this is simple. Paint by number. That's what we're doing. We're not trying to be Picasso. We're just going to paint by number. And I've now loaded that clear composite, and I've sealed in that halo, those blues and those grays. And I'm going to cure that in place. Okay. That's what that looks like when we're done. You really can't see the blues and the grays yet. They're going to come out here as we polish because we've got too much composite on top of them. But I want to show you how I get my primary anatomy now, because it's a little bit of a blob of composite. We've done really, really well. But I'm just going to draw some simple lines here. The way I like to do this is I draw a line from the zenith to the papilla. Halfway from the papilla to the zenith, I'll draw 2 dots. And then let's draw some lines. And we're almost done here, guys. I'm going to show you the results here in just a minute. Once I've got those lines drawn, again, I'm creating my shadow areas now. So it might be a little loud here, but I'm going to use a disc, and I'm just going to erase that extra composite up to the pencil line. And I'll do that on both sides, both mesial and distal. So now I've got a shadow area, and I've got a mirror area, that mesial and distal. Very simple shaping process. Draw a couple of lines with your pencil and shape it into place. Good. Okay, that's going to be how we shape that. That's that beautiful shape now. I'll actually skip this slide because I don't want to, I'm going to do the same thing with a little bit of diamond, but basically that's my shaping process. It's very, very straightforward. I do have a little video here when we want to add some anatomy. We'll also do this with the pencil line. I'll do the same thing here. I'm going to draw a line from the center of the tooth up to the zenith, or what I perceive to be the zenith. And then I'm going to use this space in between. That's the other shadow area. There's the distal shadow area. Basically, I'm just going to use this drawing to create some space here where I know I'm going to be able to erase some pencil lines and create some facial anatomy. Simple, guys. Once you watch this a couple times, you'll get it. It kind of seems intimidating at first, but it's very, very simple. So I'm going to use a burr now to erase the areas that should have indentations, like little soul kisses on the facial. Okay. I'm going to skip those because I want to show you guys a case before we run out of time. This is Derek. He's a dentist. He came in with that really dark tooth on number 9, difficult to work with a little bit. So we're going to put some opaquer on that first, and I'm going to take off the old composite. So there he is. You can see he's got an old class 4 composite. He's got a darkened tooth. He wants a brighter smile. We're going to take that composite off, and we're going to end up with something like that. So that's him without his composite on there. Now, what's the first step, guys? First, we're going to use our putty guide that we made off of our wax up. We're going to load it with Luna 2 Nano Hybrid, and we're going to create 2 tips on 8 and 9. And that's what this looks like. There's my tips. So let me go back. Let me go forward. Okay, just putting on the tips. Nothing too difficult. Now you've seen here, I did what I did with that Mylar. I put the Mylar around the outside. Okay, so here's prepped, tips. I put the Mylar on the outside of the tooth, and I use my Luna 2 around the outside, and look what I've created, a frame. Notice how the inside of the frame doesn't have any composite in it yet. From here, I would just add that blue, that gray, and those mamelons, and then I would seal it with a clear composite and one more layer of regular body composite, let's say the shade that we're looking for on the top, and that's what we have. We're adding our pencil lines, and then we're putting a little bit of texture in the tooth, exactly how I showed you, and check out how this turns out. There it is. That's what happens when we polish it. I'd be happy to go over the polishing protocol, but that's it. You look at the incisal edge. We didn't lengthen his tooth at all. I'm going to go clear back here. Now, he didn't have that much incisal edge translucency, but he's a dentist and he wants it. He wants that to look really, really cool with some dentist features. So I even added like little dimples on the lateral incisors where the mamelons would be. But all of that incisal edge translucency, that's not real translucency. That's the SDI tint, okay? The little 3 mamelons that you see there in the middle, that's just flowable composite that's a little bit more opaque. That's how it created all those effects. Would you rather paint on a white canvas, or do you want to try to make a sculpture? Sculpture's hard. Just paint on a canvas. It's much easier for everybody. You can still get these beautiful effects. This is that case there from top to bottom under different lighting. So when I use a really, really bright light, I can show you it's quite bright. He's got white teeth now, but in normal lighting, it looks good. It looks natural, and I've created some natural features and textures. So that's the case. That's the side view, and this is the same day. You can tell I pulled cord there today, and his gums are in pretty good shape. They'll be perfect in about 12 hours. That's the same day when we just finished that up. It's a beautiful case. Doctors that can deliver aesthetic results, you guys are going to be rewarded. The number one search that's happening right now when it talks about cosmetic dentistry is not veneers. People aren't searching veneers. They're literally searching non-invasive more often than they are searching the term veneer. I want to know what questions you have. I'm going to jump into Q&A here in just a minute. So Ryan Cormack says, I've had patients occasionally disappear during the planning stage of smile design. This is lost time and money. Any tips on committing the patient before the wow appointment, showing them the temps on the teeth? Yes. I recommend that you get really good at mocking up. It's not that hard. And what I will tell you, I will have 90% closure, Ryan, if you can just sit the patient down the day of consultation, get the scan and work on the wax up, but Do not let them out of that chair until you've taken some composite resin on your thumb and just put it on their tooth, okay? Get some SDI XB, Luna 2 XB. It's like extra bright. It goes brighter than that, but the extra bright's still pretty bright. Just use your thumb and an instrument to quickly mock up some teeth. Use those concepts that I just showed you about a mirror and shadow, where you blot it on there with your thumb, get the incisal edge right, and then tuck those shadow areas in with the spatula and harden it. Do that 10 times. It should take you about 90 seconds per tooth. So your consult is a little bit longer, but mock up in the patient's mouth the day of, and that is gonna, if you can do that well and get a little practice at it, they're gonna see that in their mouth and they're not gonna cancel on you. They're gonna be calling you every day because they're gonna like it so much. How do you get resin embedded into the cord? That happened to me once. It was a nightmare. Okay, so that Mylar strip should go underneath the gum line, and you need to be careful with having that tight against the tooth, as tight as you can. The cord is there as a backstop for that. If that happens, pull that cord. You're going to have a little bit of a rough spot, and get in there with a 12 blade and click it off. It's going to be the composite is so thin that it's going to be easy to get off, but do not get in there with a burr, okay? Pack or pull your cord to get the majority of it out. If you got it like covering the burn, you've left a huge ledge, that's probably a start over. Maybe you should prep that off. But if you just got a little bit of a snag on the cord as it pulls out, just get in there with the 12 blade and clean it up. Matthew Stepanowski says, Stempowski, sorry. What instrument do you use to place your cord? Is the patient numb when you place the cord? Yes, I do numb the patient for cord packing, and that instrument is called the Baiana. Unfortunately, I bought that in Brazil, but I also really like, there's a brown spatula from SDI that is also good. Okay, that really, really helps. Let me just read this next question. Sorry, I'm just scrolling down here. What are your thoughts on BioClear Matrix system? I've never used it. Sorry, I wish I knew more about that. But I've seen some good results. I have some friends that use it. Will resin veneers always add length to the teeth? No, that was kind of the point. Sometimes we don't want to add length, and so sometimes we'll just bring that resin straight out from the incisal edge and leave the patient's incisal edge. Did you do all 4 incisors for him? Yes. I did actually 10 teeth for him. Elizabeth says, can we do a course with you? Yes, please come and do a course with me. I'm going to give you my contact information, but I love doing hands-on courses as well. Adrian will have some information on that as well. What do you do when you have a dark shade? Yes. When you have a dark shade, you're going to need to use opacers to mask the shade, and you're going to need to use SDI Dentin instead of SDI Luna 2. The dentin is going to block out those shades and help us modify shades.
Are the Mylar strips contoured or straight?
I've tried them both. I'm not sure that I notice a huge difference. Straight's okay.
How are you able to retain the Mylar strips without the use of wedges? And how do you place it subgingival with cord already packed and no gingival bleeding?
So make sure all your patients I insist that they have a prophy 30 days prior. I also am going to make sure they use something like Closis or something like that, some kind of anti-inflammation mouthwash a week prior. So they need to come in with really, really healthy gums. I don't have any bleeding with the cord because the patients are pretty healthy. In answer to your question on how do I make that Mylar stick, most of the time the contacts in between the teeth will hold it. But if I ever have trouble with it, like I'm closing a diastema, sometimes I will adhere it with flowable composite on the adjacent tooth. So let's imagine that I've got a Mylar on number 8 or 9. I might flow some flowable, unbonded, no etch and bond, just put some flowable on a dry lateral and connect your Mylar to that. That will hold the Mylar in place for you a little bit while you can work with your hands. But honestly, guys, you guys need to probably do this with me. Come to a course sometime, and I'll show you more, but this kind of gives you some concepts and some ideas. James asked, what do you charge per tooth? I charge $1,100 per tooth.
Another question from the chat is, how does the wax up help in these cases if we are doing freehand composites?
Well, the wax up is mostly there for your incisal embrasures, which is definitely the hardest part. So remember, the halo veneer needs to be 1.5 to 2 millimeters thick on the incisal edge. Do you trust yourself to eyeball that? I think that's very challenging. So the wax up is principally there to give you that strong putty matrix for the incisal embrasures and the incisal thickness. Sometimes, however, I will use that wax up again on the facial surface. And it's a little bit, I didn't have the ability to show you here in this presentation, but if I'm having trouble getting those facial contours correct, sometimes I will put that putty matrix over the top of the tooth and almost like an injection molding technique, capture those last difficult line angles and facial anatomy. How long is the appointment scheduled for? 30 to 40 minutes per tooth. Yeah, that's about right, Dr. Patel. About 30 to 40 minutes per tooth. So I will have up to 7 hours for a 10-unit case, including lunch and photos and things like that.
Another question, why don't the two tips stick to each other?
You're gonna eyeball that. So what you're gonna do is as you put those two, that composite into that putty matrix, the putty matrix does have an embrasure. That's one of the reasons we have it. So little in central embrasure, that little 60-degree one that I told you about, you can see that on the putty matrix. There's a natural separation by the putty, but you have to be a little bit careful. You would take a very fine instrument right before you cure them and just make sure that they're separated. Do people notice the additional thickness? James, I'm so surprised, but the answer is no. No, they don't. As long as it's well polished, they don't notice it. But thank goodness, because I want them really thick. Elizabeth Carter says, so the matrix that is designed for you is the putty. What is the lab in Brazil making for you? The lab is making a wax up for me. The putty I make myself off of a model. So I will scan the patient's teeth and I'll send that to Brazil for basically a 3D design. And then they'll send that back to me and I'll either print it or have a lab print it so that I have a model of what I want the teeth to look like in the end. And then from that, I'll make two putties, one for the incisal and one for the facial. Sometimes I use the facial one, sometimes I'll cut it the way I showed you today.
What's the coarseness of the disc?
I use a few discs, and I would say the one that I was using there is medium. You want to be careful because you need to go in there interproximally and have that polished again. So you don't want to disc anywhere that you don't think you can reach back in with the polishing. I am using a Sirona. I've got another question from James. I'm using a Sirona curing light, but a Velo is also a great choice. I can't get into that too much right now, but you really do want to look at what the spectrum is on the bulb and how intense it is, because it does make a difference. Please review your polishing technique. I can make this pretty simple. What I want to tell you guys is stay away from diamonds when you begin to polish. You really, really need to go to a 12 fluted carbide, a carbide burr that's a fine carbide. Let's just keep it simple. Use a finer carbide burr and cover all the surfaces that you've touched with a diamond before you move into finishing and polishing, into polishing. And I think you'll find that your polish will come out much better. The polishing technique is a little bit lengthy, and so I might have to go over that at another time.
What's the name of the instrument packing the composite?
That is called an Optrosculpt, and that is made by Ivoclar. It's an excellent instrument.
Someone is asking for wax up information.
Contact Pablo Mello, and it's PABLOTMELLO0 and he speaks English. Send him a scan and some photos and some directions, and he'll already have most of my protocols memorized and archived and libraried, and he can create designs for you for about $8 a tooth. I am doing training currently at my training facility in Phoenix, Arizona. I have a course in May, and I have a course in October. We may be getting together for additional courses this year because I think those guys are almost sold out as well. So those are 2-day courses. They're completely hands-on. We do about an hour of lecture, and everything else is actually doing it. So it's a lot of time actually working on models. Victor Navarro, really quick, just asked, do I use glycerin in the last photopolymerization? Yes, I do. And I photopolymerize like 90 seconds or more, Victor, sometimes more. I like to photopolymerize in between each burr that I use in finishing and polishing. I'm going to go down a couple more slides here, guys. Let's get out of this. This is my contact information. If you want to reach me, I would love to speak with you. Guys, this is so fun. It is so fun when you can do it well, and it's very profitable. I'm going to put one more thing out to you guys before you go. Listen to me here. You probably in your dental practice are lucky if you can do $500 to $1,000 an hour in your practice. If you're doing $1,000 an hour, I know you all have days that are $10,000 days, but it's not every day. If you could average $7,000 to $8,000 in a day, that would be a very good day for most of you guys. For me as well, right? But what's crazy about that big day, when you do $7,000 to $8,000 a day and you are doing fillings and crowns, you got an entire staff behind you. It's costing you 60% of, of overhead to do that $8,000. You can do a case like this for $6,000 to $8,000 right away. And when you do that, what you're going to find is that your overhead's not going to be 60%, it's going to be 20% because your overhead is just some composite and one assistant. It's a long day, but you're going to have a more profitable day. And it's very fun and very rewarding. And so I hope that you learn this skill. Take some courses, learn how to do anterior direct resin composite veneers. I like the halo technique because I think it's simple, but it is really, really a wonderful procedure. It's more profitable than almost anything you can do in your dental practice, even though your fees aren't as high as some other stuff. You're going to really enjoy it. That's my phone number there that you can see on the screen there. Call me. That's my office number, and you can find me and DM me at Dr. Drew Ballard on Instagram.